I'd like to call the Human Service Committee to order, please. We'll start with roll call.
Mrs. Burdick,
Here.
Mrs. Ricketts-Swales, Mrs. Hanchett,
Here.
Mr. Harris,
Here.
Mrs. Root, Mr. Rumfelt,
Here.
Mr. Stockin.
Here.
6 present, 1 absent.
I would like to call for approval of the December 1st minutes, please.
So moved, Madam.
Motion by Mr. Harris, second by Mrs. Ricketts-Swales. All in favor? Aye. Carried. Dr. Anderson?
Thank you, and especially thank you for working this in as quickly. And this is one of those examples of if the department heads didn't work together, this would not have happened, it would not have occurred, and we would not have gotten the $77,000. The treasurer was most helpful in making sure that we got this in and all the equipment ordered. We're extremely grateful for that. If there are any questions about this, I believe you've all had the opportunity to read it. It's money that we did not spend in 2020 or which was extended into 2021, and we still did not use it, so they let us buy equipment with it. So we're purchasing 2 cars, 6 scanner printers, and a printer.
So moved, Madam Chairwoman.
Second. Mrs. Ricketts-Swales, all in favor? Any discussion?
Madam,
Yes.
just Terry, this is all good with you. You can fill in the blanks and all that.
That is correct. I ended up being the one to prepare the MOE, so yes, I'm fine with it.
Okay, thank you.
You're welcome.
Any questions for Dr. Anderson on it? All in favor? Aye. Aye. Carried.
Again, thank you very much.
Thank you, Dr. Anderson. Tyler Shaw, Public Health Director.
Good afternoon, everyone. Monthly report. Our breastfeeding coordinators are back in the hospitals doing rounds, so that's always good news. We've seen our routine immunization clinics are back up and running this month, and we'll have some additional flu clinics going on this month as well. That's pretty much it on my monthly report. Before I get into COVID-19 updates, I'll take any questions on the monthly report.
Does anybody have questions for Tyler on his monthly report? Okay, Tyler, go ahead on the COVID.
Okay, I got a bunch. I'm sure everyone's seen the 5-day isolation quarantine period that's been shortened for the general public. There are 2 guidance documents out there. They'll be posted on our website and also going out in a press announcement later today, hopefully. This will be implemented today as we received the state guidance last night. And then I passed some information on to Tiffany for the minutes as well. That'll be published. 5-day shortened isolation quarantine period for the general public, and then there's a separate guidance document for return to work for healthcare workers. So there are 2 guidance documents out there. There's supposed to be guidance coming for K through 12 schools, possibly next week. But what that means for the shortened quarantine isolation period is, in general, it's 5 days. That's for fully vaccinated and unvaccinated individuals. So it does cover both of those entities. That is quite a change. In that guidance document on page 2, it is buried in there that in order to be considered fully vaccinated for a contact to a positive, you now have, if you're eligible for a booster and you are not boosted, you would have to quarantine for 5 days now. So if you are in that eligibility window for your booster, we do encourage you to get your booster. But if you are exposed to COVID now, you would have to quarantine for 5 days if you are eligible and did not receive your booster. That's for anyone 18 years of age and older. Contact tracing may look different next week. We are anticipating state guidance for what that will look like. So We are hopeful, and it certainly would be a lifted burden off of our staff, is if we are no longer reaching out to contacts of positives. We would just focus on our positive cases. If they're a community contact, let that positive case reach out to their community contacts and let them know that they tested positive. We're not sure what the state guidance will look like, but that has been thrown around at the state level. We are trying to push out our at-home test kits, and we're feverishly trying to put together some sort of reporting portal where those can be reported directly on the county's webpage. That'll be dumped into our contact tracing team. So we're looking at that as the at-home test kits are distributed to our communities through the schools and through our initiative as well.
I'm sorry, Tyler, can
Yeah,
I
go ahead.
interrupt you for a second?
Yeah, absolutely.
You mentioned something to me yesterday that I thought was interesting that I didn't know, and I hope you could share it. And that's regarding if you take an over-the-counter at-home test and it comes up positive, what the benefit would be to the person to report that positive and follow up with a PCR test with County Health.
Sure. So that's even changed since yesterday. So we were not accepting at-home test kits previously. We were asking them to follow up either with a PCR or at our free rapid testing molecular clinics. That is no longer going to be the case. So once they report this to the portal, they are attesting that this is them who is taking the test, that all the information is true and accurate, and we will accept that, and it'll be dumped in for that 90-day immunity credit.
Thank you.
Any other questions on any other? I have two more things, but I don't want to make sure. There's a lot. So if you have questions, let me know. We'll see more age groups eligible for boosters here shortly. They are mulling around the 12 to 15 category. I did see the CDC did come out with lowering the booster timeline from 6 months to 5 months. So we'll see that likely rolled out in the next few weeks here. I did already talk about masks and at-home test kit distribution. So we do have some sites, and thanks to our community partners who are helping us distribute our masks. We do have some wipes and hand sanitizer going out as well. And we'll have a press announcement going out today with all the locations and times for each of those townships that the mask will be distributed. The at-home test kits will likely be next week. We did just receive the shipment today, so we'll be spinning that up pretty quickly. We want to get that portal up and running before we flood the market with our at-home test kits as well. Any questions?
So my question on the test kits and the masks is about how are you publicizing them? You said it's a press release, but I haven't seen anything, so I'm just wondering where to look for that or where to tell people to look.
Sure. So all of our press releases go on the county webpage. Under coronavirus information, there's a media release button. You can see all of our media releases. That has not gone out yet, so not surprising that you haven't seen anything. We've had a couple townships that were early adopters and kind of piloted the program to see how it'd go. It went very well. We'll have a nice table. We put it in a nice presentable format. It'll have each town, location, dates, times that they'll be distributing those. That'll be on our Facebook page. If you haven't followed the Allegheny County Department of Health Facebook page, it'll be on there. Jeff Lucky's office, which is Office of Emergency Management, will also be sharing that and pushing that out. And then our community partners will be pushing that out as well. We have a whole media distribution network, so it goes out to the newspapers. We do that through Brenda's office.
As a county legislator, you should get a copy of all press releases delivered right to your email.
I guess and that's not a problem, but I guess my question is for non-legislators, just, pointing them in those directions. Like Jeff said, there's one tonight in Houghton, but how would you know, how would anybody know that?
That's just coming through our press announcement. So we haven't
Okay.
put one out because we were collecting all that data and those dates and times. We wanted to put it in one format. We don't want to do 8 press releases with various information. We want to get it in a consolidated format.
And that actually just went out about 30 seconds
Perfect.
ago.
I knew it was in the works, so. Yes. We've already had a couple towns that have already done it last week, so yeah, not surprising.
Madam, if I may, just a comment, because I know what you're saying, and that's a good question. So I'll say, in particular for the KN95 distribution in Alfred, our local fire department did a good job putting that information out on social media. It was well covered, as was mentioned. They were able to hand out 900 masks, so people were well aware of it, but I think it's pretty much a team effort. If we get press releases dumped into our email, I wouldn't say it's our obligation, but that's our opportunity to share that news ourselves with our constituents and so forth.
Thank you. Any other questions for Mr. Shaw? Do you have any more to present, Tyler?
Not on the month report or COVID-19 update, so I just have the one request, that's all.
Okay, yep.
Okay, I am requesting approval for a Nicholson Pharmacy contract with Mr. Mark Hunter. This contract is important for our reproductive and sexual health program. We do have to have a pharmacy consultant for that program. He oversees our medication distribution, approves our drug formularies, helps us with inventory, and then also helps us with our proper disposal of expired medications as well.
Can I have a motion for that? Mr. Rumfeld, second. Mr. Harris, all in favor?
Aye.
Carried. Anything else you want to add, Tyler?
Just want to thank everyone, especially my staff. It's been tough, 7 days a week for 2 years. It's been very tough. So they're getting burned out, and we do appreciate all the county staff who have helped us. We have several departments who have offered employees to help us contact trace. And then the school districts have been very helpful. Their nursing staff, their COVID teams, we're in constant communication every single day. So do want to say thank you to everyone. Thanks to all of our community partners who've helped with vaccination clinics, rapid testing clinics, whatever we need, they've stepped up and helped us. So I appreciate that.
Well, we want to thank you and all your staff because we know you've worked a lot of hours on this and it looks like it's going to continue for a while. So thank you, and please thank your staff for all of us.
Thank you.
Anita Madison, Office for the Aging.
Good afternoon.
Good afternoon, Anita.
I have a monthly report. I'd like to highlight a few areas. The total calls at the front desk, if you look at last year at this time, we're at 1,529 calls at our front desk. This year at this time, 2,566 calls. So we have over 1,000 additional calls just coming into the front desk. Health insurance counseling, which is our Medicare insurance counseling program, where we do Medicare insurance counseling for any Medicare beneficiary, regardless of age. In November of 2021, we did 511 insurance appointments. That's 511 hours of Medicare insurance counseling versus last year at this time at 373. Another highlight would be our PC Level 1, which is our housekeeper chore activities. Last year at this time, we did 948 hours of service. This year, 1,933 hours of in-home service for PC Level 1. Another highlight that I'd like to make is our information and assistance. Last year at this time, 1,547 units of service, and that is a contact regardless of time. So that contact could be an hour, it could be 15 minutes. But this year we're at 1,919 contacts with individuals. Our PERS continue to go up. A PERS is our personal emergency response button. It is a lifeline button, and we do fund those services. Last year, we were at 151 units in seniors' homes. This year, we're at 173 units. And our Meals on Wheels is always changing. This time last year, 7,716 in-home meals, 339 congregate. This year, 7,670 in-home meals and 792 congregate. Now that is actually down from last month because we had 3 holidays in there, and we run about 430 meals currently in home every day, Monday through Friday. Another highlight that I'd like to point out is our waiting list. So our goal was to reduce our waiting list, which was happening. We actually have added to our waiting list, and that is because of discharges from the hospital for individuals who have been admitted due to COVID and then needing services when they come out. Unfortunately, we are having to put them on a waiting list currently. So our numbers did go up for the waiting list, and that is a direct effect of the hospitalizations.
Anita, do they have any other source for help other than your office if they're on a waiting list?
They do. There is Medicare help. It's called Medicare help. So if somebody is in the hospital and they receive Medicare, then they can get some assistance through a CHA, Certified Home Health Agency. For us, that would be WillCare. But that's only short term, and so they still end up on our waiting list because it's a transition of services.
Thank you.
You're welcome.
Anybody else have any questions for Mrs. Matheson? Yes, for Mr. Harris?
On that one, anything that you need or anything that if you got would be able to alleviate, other than money, alleviate
Okay,
that,
well,
that problem?
There's always been a home health aid crisis. It's definitely, it's increased in the past 2 years, which you're aware of. We did hire the 2 part-time laborers. We have them working as many hours as we can. So I would say staffing for in-home care workers, but money really is the bottom line.
When you get a call for service, and do you ascertain whether or not they're eligible for Medicare help, and if so, do you kick them over there first?
Yes, we assess them for everything. So we actually do what's called a prioritization. Our waiting list is based on that. It's based on a number of things, not just age. So it also is insurance. We look at if they have Medicaid. Is there a way for them to get any services through Medicaid? If they have Medicare, do they qualify for the Medicare help first? We always look at other options like long-term care insurance and see if they have any long-term care policies. So we also work with the VA to see if they qualify for any veteran services, and then we collaborate with veterans too.
Okay, thank you. And then one more quick one on something else. The increase in phone calls, is that almost entirely COVID-related questions?
Actually, it's not. I mean, we have had a huge increase in our COVID calls, but it is individuals who are looking for modifications to their home. A lot of people are calling about nutrition. So it is a part of the COVID, but it is not entirely. I can't say that it would be entirely that.
Any chance that those phone calls are coming into your office instead of, say, to their primary or to the hospital because of a kind of secondary to COVID?
I would not say so because we actually have had a lot of calls directly from the physicians as well, and the providers. So, and that would be clients calling them first. So I would say no.
Okay, thank you.
You're welcome.
Does anybody else have any questions? Okay, and Anita, we'd also like to thank all of your staff and you for all the many hours that you've done to help protect our seniors. Thank you.
Thank you.
All right, we have Edna Kays, Social Services Commissioner.
Good afternoon.
Good afternoon.
On our monthly report, I think that unless you have questions, a couple of highlights I want to say is I want to thank you very much for the books for our foster care children. Thank you. They were a great hit. Thanks for those donations. We were able to secure some food boxes and we're able to give them out to some of our families this Christmas, so that was really good. If you take a look at the foster care adoption services and you look at the number of children in DSS foster care, you'll see a significant difference between 2020 and 21. That, I believe, is a result of the Families First initiative, where the state's initiative was to rely more on relatives and resources in the community for the placement of children rather than putting them in foster care homes. So it looks like we're having some success there, and we still do provide that casework assistance to those children that are placed in relatives or other community member homes that we provide to those children that would be in foster care. So I think that is a good change, so I'm just wanted to make sure that I pointed that out to you. For the new folks, I'm hoping that you all received the key that goes with our report, so you have a sense of what it is that those numbers signify. And if not, we'll make sure that we get that to you before next month.
Did everybody get that? I don't think we did get it yet.
Okay,
So,
so I will make sure that gets out to you for next month.
thank you. Okay, and you have a request to fill?
Yep, we have a request to fill one caseworker position resulting from a resignation. The annual salary is $41,309, a range to $51,537, of course, based on experience. Source of funding for the position is 35.5% county, 21.89% state, 42.54% federal.
I have a motion. Mr. Rumfeld, second by Mr. Harris. All in favor?
Aye.
Carried. And then you also have a request for approval for the Allegheny County Community Service Contract.
Yes, this is a result of Families First, and the way we place children. We need to have a qualified individual that evaluates the children. We do receive reimbursement for that, and we are trying to expand our qualified individuals for those evaluations because we do share them. However, if we share it within our county, we'll have better access, and then that funding then comes back to the county. So we thought it would be a good partnership with Dr. Anderson and his agency to have a qualified individual there.
We have a motion to accept that by Mrs. Ricketts Wales and a second by Mrs. Hatchett. Any questions? All in favor? Carried. And then you have a request to accept and appropriate a New York State Safe Harbor funding.
So the Safe Harbor funding has moved from the Youth Bureau to the Department of Social Services. The funding's in the amount of $43,350. At this point, you have a list there of where the appropriations would go. We would like to look to put that in the Child Advocacy Center to have that work done there. They do tend to our survivors of any kind of trafficking or those that are at risk. So we would like to build a practice around that. And should this funding at some point in time not be available to us, there are ways that we might be able to compensate that with the child advocacy funding and grant writing that we do there.
That sounds like a good plan. We have a motion to accept that. Mr. Rumfeld, second. Mr. Harris, any discussion, questions? All in favor?
Aye.
Carried. Any other questions? Okay, and Edna, we'd like to thank you also because your clientele certainly were affected by COVID as well, and I know all your staff have worked very hard, so thank you.
Thank you.
County Administrator Knapp.
Good afternoon. I do have a request on here for authorization to renew an existing contract with NMS Labs, so we'd be looking for this to go through for a resolution. And NMS Labs does the toxicology lab services for all the pathology that goes through Monroe County. This is so our coroners can send work out to Monroe County for medical examiner and toxicology work. NMS is, again, the lab that does the actual toxicology labs, so.
So moved.
Second, Mrs. Ricketts Swales. Any discussion or questions? All in favor?
Aye.
Aye.
Carried. And you have another request.
The last request is actually for the ME services for Monroe County. These are the people that would be using the NMS labs, so since we've done the labs, it'd be good to have the ME on board as well. So we'd be going forward for the resolution to approve the contract with Monroe County for the medical examiner services.
Motion for that, Mrs. Hatchett. Second, Mr. Rumfeld. Any questions or discussion?
Madam,
Yes, Mr. Harris.
I'm going to look like a fool here because I'm sure I'm wrong, but didn't we used to have two ME contracts, one with Monroe County and one with Olean General?
I believe we still do use Olean General.
Okay, but that contract's not up or something?
It's not on today's agenda. I could look to see when it's up, but I believe we still have a relationship with Olean General.
Okay, thank you.
Any other questions? All in favor?
Aye.
Carried. Clerk of the Board, Brenda Rigby-Reilly.
Yes, the Community Service Board recommends that Brooke Bratt of Angelica, Janice Burdick of Alfred Station, and Deborah Marshall of Wellsville be reappointed to a 4-year term commencing January 1st, 2022 and expiring December 31st, 2025.
I have a motion to accept those. Mr. Rumfeld, second by Mrs. Hedge. Any questions or discussion? All in favor? Carried.
The chairman of the board recommends that legislator Janice Burdick be appointed to fill the remainder of Judith Hopkins' 6-year term expiring July 7th, 2025, as the legislative representative on the Board of Health.
Mr. Harris, second. Ms. Ricketts Swales, any questions or comments? All in favor? Aye. Carried. And one more.
The chairman of the board plans to reappoint Janice Carson of Belmont, Joseph Felton of Wellsville, Vicki Grant of Houghton, and Susan Stout of Wellsville as members of the Citizens Advisory Council to the Office for the Aging for a 3-year term commencing January 1st, 2022 and expiring December 31st, 2024, and this appointment requires confirmation by the Board of Legislators.
So moved.
Mr. Harris, second. Mr. Rumfeld, any questions or comments? All in favor? Aye. Carried. All right, any old business?
I have some old business.
Okay,
Getting back to Mr. Harris's question on that Olean general contract, that contract was a 2-year contract, expires at the end of this year. So I would assume probably December of this year, we'll see something for 2023.
Thank you.
Any other old business? Any new business? Go to the order. I will ask for an adjournment.
Motion to adjourn.
Mr. Rumfeld, second. Mrs. Ricketts Swales, all in favor? Aye. Carried. Thank you all.